Thank you again for your time, Dr. Merican. We are with the hospital administrator for the Ministry of Health, Malaysia, who is also chair of St. John Ambulance in Malaysia, in Kuala Lumpur specifically. And thank you for your time again.
Thank you, Laura, for having me.
So as we already speak in our messages, we are going to discuss the COVID-19 pandemic in Malaysia. So let us begin with the first question. So when did the pandemic officially start in Malaysia?
Okay, right. The pandemic, or the first case that we had in Malaysia, was reported on the 25th of January 2020. At that time, we had 3 Chinese nationals from Wuhan that entered Malaysia through Singapore. And thereafter, we did have occasional number of cases, but the numbers then increased in the mid of February, when we had a mass religious gathering between the 27th of February till the 1st of March in a locality somewhere just outskirts of Kuala Lumpur. And it was after that religious gathering that the numbers picked up in Malaysia. And it was then at that point of time, Malaysia actually recorded one of the highest numbers of COVID-19 in Southeast Asia. And however, with good public health interventions by the Ministry of Health of Malaysia, the numbers remain controlled, and it went down as the months moved on. And as of lately, the numbers have been in single digits, and it is controlled now.
Okay. And what were the problems, the main problems that Malaysian ambulance system, in particular St. John Ambulance, since you are chair of the association in Kuala Lumpur, had in the last months since the pandemic began?
Right. The St. John Ambulance of Malaysia, Kuala Lumpur, this organization provides a free 24 hours emergency ambulance service. And this service has been running for the past 22 years. And it actually complements the ambulance service for the Ministry of Health Malaysia, because there are high numbers of accident cases and emergency calls, that the government decided that various agencies to be included into the pre-hospital care system to support the public hospitals, especially in Klang Valley. So in Klang Valley, it is unique, whereby the 999 call system is actually further supported by 3 main agencies, namely the St. John Ambulance of Kuala Lumpur, and we have the Malaysian Red Crescent Society, who also has their own ambulance service, and we have the local civil defense. So these are the 3 main agencies that actually provide ambulance service for the Ministry of Health. Now, for St. John Ambulance per se, now, as I said earlier, because one of our core business is running 24 hours ambulance service. Now, when the pandemic hit Malaysia, one of the measures that the government took was to have the movement control order. Right now, when the MCO, or the movement control order, was put in place, then there were very limited movements amongst the members of the public, especially road traffics. So we then saw a reduced number of cases or calls that we received in March and April during the pandemic, because our usual numbers are approximately 150 to 160 calls per month. But during the pandemic, beginning March, we saw 119 calls, and then further in April went down to 61 calls. So the numbers of calls that we received through the 999 system was very, very low. Now,
Yeah.
what we did was we then supported the Ministry of Health through other initiatives. One of it was we supported the pre-hospital care in terms of transferring patients from one hospital to another. Because what
Okay.
happened was in the Ministry of Health, we have decided to reorganize our hospital functions, whereby some bigger hospitals would take up the role of having COVID patients and suspected COVID patients, while other hospitals would manage the non-COVID
Yeah.
patients.
Yeah. Yeah.
So there was a period of time where we had a lot of patient movements going on the road. So to support the Ministry of Health, the St. John Ambulance came forward with our ambulances and crew to support these patient transport services. So that's how we came in useful during such difficult times.
Yeah, yeah, indeed. As I imagine, Kuala Lumpur is one of the most jammed cities in the Southeast Asia. However, I imagine that, as you already said me, during the pandemic, you established a sort of lockdown, right? So I think that the streets were empty, of course, more than in other moments. I imagine,
Yeah.
yeah. And in particular, a question that I was wondering, as you said that you had the very first cases in 25th of February, right? As you
25th of January.
January, okay, yes. And in China, in Wuhan, they discovered the pandemic, which was not a pandemic yet.
Yeah.
In December, I remember of 2018. So I was wondering, how did you realized that these Chinese people in Malaysia were affected by COVID-19? How did you realize it? Did you have tests? Did you provided some prophylaxis methods?
When we had reports of cases occur in Wuhan, there were diplomatic communications between
Of
China,
course,
Malaysia, and also with neighboring countries, especially our closest neighbor, Singapore.
yeah.
So there were constant communications and reports of positive cases in the neighboring countries. So even in December, the Ministry of Health was alerted of these cases. We were actually monitoring our entry points, especially in the airports,
Okay.
and it was through these communications with neighboring countries that we realized that the cases were coming into Malaysia through borders, especially Singapore.
Yeah.
Yeah.
Okay. Yeah. Great. And also because I asked you this question because here in Italy, for example, and of course in Europe, we didn't realize in the end of January that COVID-19 was so dangerous and so contagious, of course. So we didn't realize it, and of course, we didn't even prepare facilities and tests. So that's why I asked you. And you also told me about blood donation. You mentioned me the activity of the St. John ambulance in the matter of blood donation during pandemic. I also saw the photos, the pics that you sent me, and the slides. So it was a very, very incredible initiative. So I would like to know more about that.
Right. So as I mentioned earlier, with the movement control order that the government has put in place, so I mean, people were not allowed to leave their homes.
Mhm.
So now that had led to the number of blood donors to be reduced, be it donors that come to the hospital or even walking donors to the National Blood Center.
Yeah.
So there was a point of time when the Director General of Health highlighted that the number of blood stock in the National Blood Center was running low. So, and again, the St. John Ambulance, we came forward with our volunteers and staff to help the National Blood Center to do blood donation drives.
Yeah.
What we did was we actually engaged with shopping malls because shopping malls physically they have large space areas.
Mhm.
So this would be ideal if we were to adhere to SOPs of physical distancing. So that would make the blood donation much easier if we were to put our couch at least 2 meters apart from each other.
Okay.
And the response was good. We managed to engage many shopping malls during that period. In fact, the blood donation drive was run across several states in Malaysia. And
Oh,
just over 3 days across various states, we managed to accumulate a total of 3,772 bags of blood to be supplied to the National Blood Center.
yeah, incredible. Yeah, very good job indeed. And in particular, are there some specific case reports of COVID-19 that are very peculiar in Malaysia? Did you register some specific pathology maybe that can be associated to COVID-19, or in pre-hospital care, have you reported some strange case of disease that can be tied to COVID-19?
Yeah, we did had I will call it a near miss on the 7th of April. My staff of the crew actually sent one patient, and it was a house call. He was
Mhm.
ill. Um, we actually sent this patient from his home to a nearby
Mhm.
hospital. And upon returning to, I mean, upon the crew returning back to base, they suddenly got a call from that hospital, the emergency department of the hospital, saying that after further history, this patient that we sent were suspicious or could be COVID-19.
Mhm.
So that sort of created a panic in the department. So what I did was I had to we had to self quarantine the two crew members who were on duty that day, who ferried that patient to the hospital. So they had to self quarantine themselves at the call center in base until the results came back 24 hours later at the hospital, saying that it was actually negative. So
Okay.
my two crew members, yeah, they had to isolate themselves, and we had to send food over. And for that 2 days, we had to stop our call service. We couldn't dispatch our ambulances out because they had to be quarantined at our base station.
Yeah, of
So
course.
we had to close down for 2 days.
For
Yeah.
today as well, it is not a so long time, but I imagine that in during the pandemic, 2 days are much. So
Yes,
yeah,
yeah. There
fortunately,
was a lot of anxiety in amongst my two staff that were involved because it was at that time it was still the peak of the pandemic in Malaysia, so they
yeah,
were worried. And one of them were actually were married and had families at home, so yeah, there
yeah.
were many psychological concerns as well.
Absolutely, absolutely. And yes, to this topic, I would like personally, I would like to ask you, um, what were your feelings during the pandemic? So, and after the peaks, so after the first harsh months, so I imagine February and until May, which were, I imagine, the core months of COVID-19 pandemic in Malaysia. What were your feelings and what did you think right now of yourself behavior during the pandemic?
Well, personally, it was pretty worrying to see what was going on in the country. And being a physician myself, working both in the hospital as well as in the pre-hospital setting, it was scary and worrying, and so much so that I had to leave very early in the morning at 6 a.m. and come back very late at night. It
Imagine.
was until my kids have gone to bed, and I know it'd be easier for me to come back at home, open the door, and straight away isolate myself.
I see.
And of course, there was, I mean, being an administrator of an hospital and also for the St. John Ambulance organization, I was worried for my staff. Of course, we constantly gave them reminders of masking up and always have physical distancing amongst themselves. Um, it, I mean, to inculcate discipline among staff as well as members of the public is something very challenging, and which is why our Director General never fails to give constant reminders every day to the members of the public through his daily press conferences. Because by constant daily reminders that we hope that we could contain the disease, break the chain, and control the pandemic to very low numbers.
Yeah, I see it. It has been a tragic situation. Yeah, and
Yeah, for all.
yeah, I imagine that also making people and just who cannot see personally the virus or patients who are really suffering from from COVID-19. I imagine that it's very difficult to explain how important is social distancing and wearing face masks, which are the main measures to avoid, to prevent. And it is, yeah, here, I mean, here in Italy, it has been very difficult in the
Yeah,
first times. Yeah,
yeah,
and indeed, I would like to move our discussion on PPEs, so personal protections equipments, and here in Italy, for example, and also in many other parts of the world, for example, in the US and in the UK, for example, we suffered deep lack of PPEs because the first times many people also in chemistries, so in pharmacies, rushed into pharmacies and wanted absolutely 20, 30, 100 face masks, for example. But the topic was you don't really need this type of masks. These are for healthcare workers. But in the first times, there were not precise indications. So storages finished very soon. So how was the situation in Malaysia?
yeah. I guess it is similar when the government first announced the movement control order on March the 18th. Uh, that sort of created some panic among the members of the public, not only PPEs, even daily products such as rice, milks,
Yeah,
oils. I
beautiful.
mean, members of the publics were actually rushing to get them stock up at home.
Yeah,
Now, coming back to PPEs, thank God the Ministry of Health, we had um, adequate supplies of PPEs, and this was further supported by tons of donations as well as contributions that came in from corporate bodies and individuals from within the country. Many have actually come forward to donate PPEs to the Ministry of Health. And as for St. John Ambulance, we actually also chip in to help um, make our own DIYs PPE, whereby the volunteers of St. John Ambulance, we actually made the face shields using
yeah,
A4 size hardcover plastics. It's DIY, and in just over 6 days, they have managed to come up with 1,008 pieces of face shields, and per day
yeah.
actually 1,008 per day, and over that 6 days
It's a
it
large
was
amount.
accumulated over 7,000. So these PPEs, these face shields were then distributed to the public hospitals in the Ministry of Health to 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 boost up this pile of PPEs in the hospital.
Yeah, yeah. I understand. Well, yes. So this far, I would like to conclude the discussion by asking you if there is something that you would like to that you would like to say, or some personal considerations on the current situation of COVID-19 right now in Malaysia from a hospital point of view and also pre-hospital point of view, maybe.
Sorry, could you please repeat the question, because I've
Yeah,
lost you a bit.
yeah, I understand. No problem. I would like to conclude the discussion by asking you what is the situation, the current situation of COVID-19 from both a hospital point of view and a pre-hospital point of view right now
Okay,
in Malaysia.
the numbers of cases have been relatively low in Malaysia. Most of our hospitals now have actually begin operations as near normal. Most public hospitals have started calling back all their patients for elective surgeries. Most of our patients have been called in for their clinic appointments.
Yeah,
Um, both the Ministry of Health as well as the members of publics or patients in this case are actually adapting to the new normal. As for pre-hospital care, of course, being frontliners, precautions are always being adhered to, because
yeah,
we will never know which patients are positive, or where they come from, or their exposure like. It is always the constant reminders that we give to the members of public that actually matters.
yeah. Yeah. Okay. And would you like to say some personal considerations on the situation, on the future, maybe of this pandemic?
Yeah, I believe that every country organization should work together, especially in facing such a global problem. In this case, it is a
Absolutely.
global pandemic. So I think it is very crucial that all countries, all organizations come together hand in hand to face this enemy, be it in terms of research, in terms of information sharing,
Yeah.
and especially in fighting this virus that we have. Um, in front of us today.
Yeah, absolutely. Great considerations, and hope that the situation will solve as soon as possible. We hope for everyone. Yeah, so that's all for me. And again, thank you for your time. It was nice to discuss, to speak with you, and it was a pleasure, a real pleasure. Thank you, Dr. Merican.
Thanks, Laura. Thank you. Thank you so much for having me.
Okay.